Hello, everyone, and thank you for joining us. My name is Gisela, and I will be the host for today's webinar. Before I pass it over to our speakers, let me cover a few housekeeping items. At the bottom of your screen, you will find multiple application engagement tools. You can adjust their size and position to optimize your computer screen. To expand your presentation area or maximize it to full screen, simply click to the arrows in the top right corner. If you have any audio or video issues, you can find answers to some common technical questions located in the Help widget at the bottom of your screen. Please note that a copy of today's slide deck and additional resources are available in the resources list. Please have a look and download everything that you may find useful. Also, this webinar will be recorded and sent via the email you registered with. Lastly, if you have any questions during the presentation, you can submit them through the Q&A widget. We are here to answer you live via the chat throughout the presentation, so don't hesitate to reach out. In case we run out of time or we don't manage to answer your questions, we will make sure to follow up later by email. Now, I would like to pass it over to our speaker, Margot Bergel.
All right, thank you very much for the introduction. Hello, everybody. I am Margot Borgel. I'm the Director for IVD, Global Regulatory Affairs for RQM+. My role at RQM+ is to support clients in their IVD regulatory journey. So this includes making sure that our projects are meeting regulatory requirements and providing regulatory leadership to other RQM+ consultants and CRO team members. I provide regulatory support and guidance through the entire product lifecycle, from design concept through clinical studies, regulatory submissions, and approvals. A little bit about me is that I joined RQM+ after 4 years at BSI Notified Body, where I was a member of the IVD technical team, specifically working on IVDR, IVDD, and UKCA certifications. I've worked with many different IVDs across most technologies and many device manufacturers. Prior to that, I spent about 8 years in industry for an IVD manufacturer. And in that organization, I performed duties in research and development, manufacturing, technical support, and product transfer, as well as manufacturing. Just a little bit about RQM+. RQM+ is a global medtech service provider who provides expertise across the full product lifecycle for both medical devices and IVD companies. We provide end-to-end solutions across the complete medical device product lifecycle, and that includes many different aspects of the medtech lifecycle. We have a variety of different business units that support different projects, so regulatory and quality consulting, laboratory services, clinical trial services, reimbursement, and technology as well with our Fern AI solution. So we're here today to talk about IVDR technical files mostly. So we're going to first go through IVDR technical review and certification by the notified body. Then we'll get into how a notified body is going to approach a tech file review and common errors that are seen during that technical file review process. Okay, so first thing we have to do before we can really get into this is talk about the IVDR transition timeline. So the timelines have recently been updated. They were approved a few weeks ago by the EU Commission. And so I'm just going to go through those very quickly. We have a date of application, which passed 26 May of 2022. We're about 2 years past that now. But there is some transitional provisions for devices that are currently certified either by the notified body or self-certified under IVDD with a declaration of conformity signed before that May 2022 date. And so basically from the last transition provisions, everything has been pushed out by 2.5 years. So for Class D devices and devices with existing IVDD certificates, the new transition deadline is 31st of December 2027, and then each class is pushed out another year. So Class C is 31st December 2028, and Class B and Class A sterile are 31st December 2029. But there are some provisions that come along with this. The main one that is brand new is that you must lodge a formal application with a notified body 2.5 years before those final deadlines. So May 2025 for Class D and existing IVDDs, May 2026 for Class C, and May 2027 for Class B and Class A sterile. On top of that, there are some other provisions, mainly that you must be complying with the IVDR, PMS, and vigilance requirements as of that 2022 date of application. You cannot put any new products on the market except under IVDR. All Class A devices must be IVDR compliant. And then recently added is that you must have an IVDR compliant QMS system in place by May of 2025. Okay, so as an IVD manufacturer under IVDR, there are a lot of obligations for manufacturers. This is covered in Article 10 of the IVDR. And one of those requirements is that you will maintain and keep up-to-date technical documentation for your device. And so what does that look like? The requirements are pretty consistent across classes with a few differences as you have lower risk and higher risk devices. But for all devices, you must have that compliant QMS system. You must have a tech file meeting Annex 2 requirements, and you must meet all of the GSPRs. And you must have a performance evaluation plan and report and PMPF plan. For Class A devices, you're self-declared, so you don't have to worry about notified body requirements, but all other devices from Class A sterile up to Class D require a notified body assessment and certification. Class A and Class B devices need a post-market surveillance report, whereas Class C and D need periodic safety update reports. And that's the difference in content is pretty small, but there are some differences in where you put those documents, who you provide them to, things like that. And then Class C and D also require a summary of safety and performance. If you have a companion diagnostic, which would fall under Class C, you're also going to need to do an EMA consultation for that CDX. And for Class D devices, you'll need to adhere to common specifications or potentially go through expert panel review. And you'll need to interact with the EU reference labs, which includes product verification and batch release. This slide is just an overview of all of the technical documentation that is required under IVDR. I'm not going to go into every single thing on this list right now, but this will be here for your information. And it's mainly covered in Annexes 2 and 3 of the IVDR. Okay, so now I'm going to talk a little bit about notified body processes. Each notified body is going to have their own kind of nuance to this process, but this is generally how it will go. So you as the manufacturer will submit your application to the notified body. There will be some back and forth there as you talk about your devices, what classifications they are, what kind of groups are going to get set up, things like that. And once that's all situated, you will sign a contract, and then you'll be officially under contract with the notified body. They will do what's called an application review. This is covered in Annex 9 of the IVDR. They'll basically just make sure they have everything that they need, that they agree with classifications that you've provided, that they have assigned the right codes to your devices, things like that. After that is complete, the actual conformity assessment activities will start. So QMS audit and technical review. Different notified bodies are going to do this slightly differently. Some don't have any constraints. You know, they can do one or the other at the same time, separate. You know, there's kind of no contingencies. Other have some requirements that the QMS audit happen either before or after the tech review, or that you have to have certain aspects of your technical file complete before the QMS audit occurs. And that'll be something you discuss with your notified body. Once those two things are complete, there'll be a certificate recommendation, and then some sort of a review and approval process. So this is like a panel review at some notified bodies or a decision maker review. And then after that, the certificate will be issued. When we break down that technical review into a little bit more detail, this is what it looks like. So you submit the documentation to the notified body. Most notified bodies do what's called a completeness check, where they just look at what you've submitted and make sure they have all the documents they need, sort out any deficiencies. If it's a Class D device, you'll need to make sure that you're meeting certain requirements for those. So mainly, have you met common specifications, or is it a first of type Class D without common specs? So then we'll get into tech review. That will go through 3 rounds of questions typically for most notified bodies, where you'll be able to resolve deficiencies in your technical file. That'll go back and forth. While that's happening, if you do have a Class D, that first of type expert panel review process will be ongoing. After all the questions are closed, then it will be reviewed by an internal clinician. This is a new step in IVDR that didn't exist before. They're going to just review the performance evaluation mostly, and the clinical performance, and make sure that everything looks acceptable. And then the review will be closed. If you have a companion diagnostic, after the review is complete and all of the questions are closed, only then will the CDX process start. So that's the specific EMA review that's required. So if you have a CDX, keep in mind that that will extend the timeline quite a bit. And then if you have a Class D device, at this point in the review is where either EU reference lab activities will start, or other stipulations while we wait for EU reference labs will be put in place for your batch release. So that will also add a little bit of time on the back end of the review before everything is finalized.